has identified the cause of the mysterious new virus.
Coronavirus.
There are fears a rapidly spreading virus has reached Australia.
This is a rapidly emerging situation where there is not a cause for alarm.
The first U.S. case has been detected.
The future of design needs to prepare for the unpredictable future of health and disease control. Health experts estimate the annual probability of another pandemic on the same scale as COVID-19 to be around 3%, meaning that there is roughly a 47 to 57% chance of another global pandemic occurring in the next 25 years. These numbers illustrate the importance of preparing immediately for future outbreaks. Health insurance makes a difference in whether and when people get necessary medical care, and ultimately, how healthy they are. Uninsured people are far more likely than those with insurance to postpone health care or dismiss it altogether. The consequences can be severe, particularly when preventable conditions or chronic diseases go undetected. According to a study from the Centers for Disease Control and Prevention, each year nearly 900,000 Americans die prematurely from the 5 leading causes of death. Yet 20 to 40% of deaths from each cause could be prevented. Technological developments have changed healthcare dramatically. From anesthetics and antibiotics to magnetic imaging scanners and radiotherapy, future technological innovation and design is going to keep transforming healthcare. Healthcare experts agree that detecting early-stage disease is essential for survival. For years, scientists have been working to create a blood test to detect early-stage disease. The motivation is clear. Survival rates are substantially higher when conditions are detected early. So how can we use design to see any potential harmful illnesses and deadly diseases before it is too late? My design solution for this problem is to take advantage of existing technology and up-and-coming technology, merging the two to create a design that helps inform the health of people and works to track any potential deadly disease that may be on the horizon. With this data, we can help locate any potential threats to individuals' health and associated areas around the world where diseases may be arising to help us contain these deadly diseases before disaster strikes. This is done through the design of an app and a medical device that plugs into any mobile device. I wanted the app to be easily accessible and adaptable to users who may have an iPhone or Android. The device may also be plugged into any laptop or computer. The goal of the app is to be able to give quick results similar to a rapid COVID test. The user can test their specimen to detect any potential illness. This data runs through the application to help diagnose the individual. The app also helps connect the user to their local doctor's office so that they may receive professional attention as soon as possible, and of course, free of cost. Not only will this help people stay on top of their health, but it can help professionals be aware of what is happening in their area and aid in preparing them for any potential outbreaks. The user is prompted to fill in general information about themselves and any health conditions they may have, as well as their area of region. Once the profile is established, they are prompted to a homepage which displays a series of short questionnaires to help determine what type of test they will require, whether it be a blood test or a saliva test. This, of course, is based on any symptoms they are presenting. The user takes a sample of their specimen and places it on the device, which will run an analysis to help determine a diagnosis. After a few minutes, the user is given a report of their diagnosis. With this data, we can help keep an eye out for each other, detecting problem areas around our cities and countries, as well as working to prevent another worldwide pandemic.